time with the folks from OrthoUnited, and I know it's about to get a lot better. Oh, my good friend, Dr. Ira Richterman is with us this morning, and good morning, sir. How are you?
Good morning. Thanks for having. I always love coming to be a part of your program.
Yeah, we always have a great conversation. We were just saying that off the air, and there's so many different things to talk about, but well, first of all, give everybody a little bit about your background, because
Sure.
that's important, I think.
Sure. So, it's just to give everybody a little history here of myself. I'm originally a Jersey boy. Came to Ohio in 97, and at that time I joined Omni Orthopedics as a hand surgeon for our group. And throughout the years of being involved with our community, with my kids, my family, with work, with the hospitals, we've developed a very strong love for Canton, Ohio. And most importantly has really been the past couple years where we felt orthopedically within our community to be able to merge and get together with my colleagues across town at the Spectrum campus and formed OrthoUnited. It's been an absolutely wonderful continued blessing for our practice, we believe for our community. It allows independent orthopedics to continue to have success in our environment. Unfortunately for the world, we see a lot of very, very large organizations that continuously occur and buy up a lot of the small businesses, and healthcare sector is exactly the same. And whether it's my friends in family practice, internal medicine, all the other various subspecialties, we're seeing really a dichotomy of flow in healthcare. They're either going to stay on the independent side and really try to do our best in staying what I would call at the root level and fight for the patients, with the patients, and do the best care with them, or they become a little bit more institutional. I think the best example, and I'm sure a lot of your listeners would agree, personally, I do not like calling a physician's office and getting a phone tree. I like talking to a person.
Right.
I think the person enables you to hear what your issues are, what's going on, and at our OrthoUnited business model, we really believe in the human quality of the person talking to our patients. Sometimes, yes, people get placed on hold. We realize that. Sometimes things will get placed into various voicemails that we try to do our best as can, as answer them as quickly as we can. As a matter of fact, it's good and bad on the next thing I'll mention, but as a matter of fact, with our phones, the office comes with us on our phone. Now, of course, that's good and bad because we never leave work, as we all know. That's not always necessarily a good thing. But even when on vacation, my wife knows around 3 o'clock every day, I grab my phone, I take 15 or 20 minutes, and all of my patients who have called in for that day, who have an issue, a problem, a concern, I answer every question. Now, my clinical assistant will call that person back, but I think it's really important. It's an easy time in my day, and for me, it's really caring about our patients. I think a lot of my partners are starting to do the same thing. It's just staying attached, and again, it's good and bad. Sometimes, sometimes you have to leave work. I get that, but for me, it seems to be easier, and I think OrthoUnited has really is moving in a very, very strong direction, in the fact that one of the things we're going to be introducing here very, very shortly is online scheduling. So if you need to make an appointment, you'll be able to get right on your phone. If you say, hey, I want to go see Dr. Richterman, let me see when his next available is at the end of the week, you can get right on your phone very shortly, and you'll be able to schedule your own appointment yourself.
That's awesome.
Yeah, and I think that's where the world is really going. Everybody wants to do everything on their phone, whether it's banking, healthcare, right? Picking something out so Jeff Bezos can bring it to your house from Amazon. We want it on the phone.
Get my hair cut.
Yes,
Yeah.
Absolutely.
That's right.
And people go and search medical issues as well. You know? So if they want to say, oh, I think I may have carpal tunnel syndrome, and of course they want to go to Google Doc and WebMD and all those things right on their phone. And I just think that's where the future is truly going. And I think online scheduling, it's not for every physician and every specialty, because some specialties it's a little easier than others to do that for. But I think it's just another option. And I really think the most important thing that we're trying to do at OrthoUnited is really availability. If your little kid falls off the swing set at Jackson Park, this afternoon, and their wrist is hurting, and your mom, and you got 2 other kids with you. What do you do? So to go and spend 6 hours at an emergency room for a main hospital, it's not that it's bad healthcare. It just becomes a time factor.
Yeah.
It's costly healthcare. It's very expensive to go into a big institution. Where if you come over to the OrthoUnited Express clinics, it's easy. It's in out. It's orthopedic specialty care. Now, obviously, we're not taking care of colds and flus and coughs
Right.
and chest pain. But if it's an appropriate orthopedic injury, absolutely. And I think that's really what the key is for OrthoUnited. It's just easy access. Make it easy for the patients. Provide absolute quality care. And I think that's with the merger is helping us to do that. I myself sit on the on-the-campus side. It's just the way our board is kind of set up there. So I'm still kind of in charge on half of the campus. Dr. Shepard, who's really theoretically my counterpart, is doing the same thing on the Spectrum side. And then we combine together to sit on the Ortho combined board together, truly to do what's best for the corporation. And it's worked very, very well. We have 8 members that sit on our board from both groups, 4 from each group, that has put this together. And I really put a big shout out to some of the partners, Dr. Wake and Dr. Stefanko, who really, really put in a massive amount of energy and thought process into putting this all together to make it happen. And I think now it's just a matter of continuing to move forward and never forget the fact that the most important job is to take care of patients.
Yeah. I mean, it's been, when I first came in, I talked to your COO, Fred, and he was, saying it was about a year and a half. I said, it's also very comfortable already. It feels like it's been much longer to me.
Well, as a matter of fact, we tried several times to put this merger together. And the previous couple times, we had some issues with failure from various obstacles, whether it was an accounting obstacle or a legal obstacle. And so this is not the first time we tried to create this merger. It's just as the environment of healthcare sector has changed and morphed through the years, it's put us in a position that it was an absolute ideal thing. We would love to continue to grow with all of the other orthopedic independent practices in Ohio. There's several very strong practices that do good quality care. And I think for the delivery of that care to the patients, if we can continue to make that sector bigger and bigger, as a matter of fact, we're opening up a new office up in Fairlawn.
Oh, wow.
So that office is going to open up here at the end of August, beginning of September. We're doing a massive renovation project up there that the doctors have invested $1 million into an office setting to help create and give to the community. Summit County, although we do attract patients from Summit County that come south a little bit, it's really an opportunity for us to try to spread our wings and provide people with other opportunities in the northern Summit, Cuyahoga counties and Portage counties. Some of our physicians have also started to branch out into work at Western Reserve, which is also north of us here in Summit County. Again, for some of our patients that live a little bit further north, instead of them coming so far south, it makes it a little bit easier on if they need an inpatient procedure. But as we all know, I think orthopedics is really dominated across the country nationally by outpatient care. And surgery centers, both in OrthoUnited, we have OS3 and we have Oasis as both of the centers that all of our surgeons operate at. I think it's really the care and the ease and the feasibility that it allows patients to have. Without getting in too much of the details of the cost perspective, if you are a self-insured individual and you go to a hospital setting, it is much more costly to get the exact same quality of care. And quite frankly, at our surgery centers, it's just so easy to get patients in, out. You were commenting earlier about
the
fact, yes, we have your patients, when you're done surgery, their family members literally drive in our building right through the recovery room.
Yes.
And if it's a terrible winter day, or right now, it's 95 degrees outside, and if you just had surgery and you're maybe not feeling super well, the last thing you want to do is having to trek across the parking lot. And really, it's just little things like that, the little extra things that we can provide for the patients. It's really been an absolute wonderful. So the merger, we've done a great sponsorship the past couple of years. We've joined with a long-term tradition of the Spectrum campus, which was Country Fest and Neon Nights at Clays Park. Holly Stefanko is doing a fantastic job with regards to our marketing, and we were a nice sponsor for that event. I was going to share with you a commercial that you apparently have not seen yet, and unfortunately your viewers on radio will be a little visually challenged to watch our commercial, but I believe it will get put up on social media here very shortly. It's a fun little tongue-in-cheek
we'll share it
event.
Then. Yeah. All right, we have to take our break. When we come back, I want to talk a little bit about what you do here, because you're pretty good at what you do, and I know a lot of folks come to visit you, and so we will talk to Dr. Richterman here about wrists and hands, and we'll continue with Health Week here on 1480 WHBC.
An improved lifestyle in motion.
The Plain Township Amphitheater presents the Motown Sounds of Touch, Thursday, June 20th at 7 p.m. Featuring a full band and all the major hits from the Motown era, including Smokey Robinson, Marvin Gaye, the OJs, Earth, Wind and Fire, Stevie Wonder, and many more. Tickets on sale now at PlainTownshipAmphitheater.com. That's PlainTownshipAmphitheater.com.
At OrthoUnited, orthopedic care is more than medicine. It's a commitment we make to provide accessible, world-class orthopedic solutions to our community. The partnership formed by Spectrum and Omni Orthopedics makes OrthoUnited the largest orthopedic provider in Stark County, with more than 35 doctors to serve you. The skilled orthopedic experts at OrthoUnited offer the latest advancements in cutting-edge technology and care. Local providers, helping each and every patient take their first steps toward orthopedic health. Let's get better together. Learn more at OrthoUnitedOhio.com.
Pizza's here.
Oh, great. I'd love some, but I'm worried about my stomach issues.
If you're worried about having diarrhea, gas, bloating, stomach pain, or loose oily stools, it may not just be stomach issues. It could be a condition called exocrine pancreatic insufficiency, or EPI. With EPI, the pancreas doesn't release enough enzymes to break down food, but EPI is manageable. Use the symptom checker on identifyepi.com and talk to your doctor. That's identifyepi.com. Sponsored by AbbVie.
On the battlefield, there's a saying America's military men and women live by. Never leave a fallen warrior behind, ever. Off the battlefield, Wounded Warrior Project operates with the same goal. Wounded Warrior Project was created to help our men and women returning home with the scars of war, whether those scars are physical or mental. Wounded Warrior Project. We never leave a fallen warrior behind, ever. Learn more about what we do at woundedwarriorproject.org.
What seems to be the problem?
Doctor, thank goodness. My husband found out Cricket Wireless has 5G plans starting at $15 a month, and his jaw just dropped.
Oh. Did he hear about Cricket's blazing fast 5G?
Yep.
What about their reliable nationwide coverage?
Yes, that too.
I see. Unfortunately, there's no cure. But you will have really fast 5G.
Get jaw-droppingly fast 5G for $15 a month. Smile, you're on Cricket.
Cricket 5G requires a compatible device and is not available everywhere. Video may be limited to SD. Fees may apply. Terms and restrictions apply. Subject to change. See store for details.
This is the story of the one. As a maintenance engineer, he hears things differently. To the untrained ear, everything on his shop floor might sound fine, but he can hear gears grinding or a belt slipping. So he steps in to fix the problem at hand before it gets out of hand. And he knows Granger's got the right product he needs to get the job done, which is music to his ears. Call, click Granger.com, or just stop by. Granger, for the ones who get it done.
If you need bold banners to boost your business, but you're on a budget, think Staples. Because now at Staples, you can save up to $50 on your print purchase. From posters and flyers to signs and menus, Staples can print anything you need to move your business forward. And with Staples Print Perfect Guarantee, it's done right or it's printed again free. Plus, same-day service is available on hundreds of items if you order by noon. Get it printed right at Staples. And now get up to $50 off your print purchase. N76, visit staples.com/print for details.
Sheets-Ike Electric, serving the Stark County electrical needs in commercial, industrial, and residential service. Sheets-Ike Electric is a Generac dealer who can help you install generators for your home or business. Call them for a generator quote today, and Sheets-Ike Electric is your choice to install power poles or light poles for your business quickly and safely, while providing quality service at a reasonable price. For all your electrical needs, call Sheets-Ike Electric at 330-324-2050, an IBEW NECA contractor.
With our Healthcare Week here on 1480 WHBC. We are at OrthoUnited. And, of course, with us right now, Dr. Ira Richterman. We've been talking about the merger of, Spectrum and Omni. Mm-hmm. And it has gone very well. And just talking to the other doctors and seeing the successes is proof of that. But I wanted you to talk a little bit about what you do here because – wrists and hands, I'm telling you, it's like constant. People are always talking, carpal tunnel and trigger finger and arthritis and.
Well, you'd be surprised. A lot of people will say when they say, "Oh, you're just a hand surgeon. How can you be busy?" and people don't realize that, for example, the hand is the most injured part of the body. And if you look at emergency room data. Hand injuries, which is really elbow to fingertips, is considered hand. A lot of people don't realize that elbow is part of hand. It's really the number one visit for ERs.
No kidding. Okay,
absolutely.
I did not know that.
When all of our listeners out there are playing in their gardens and playing with their hedge clippers and their table saws and their chainsaws, they have to realize it's a little bit more than just putting on eye protection or hearing protection. I will say all the time, I say chainsaws have two handles for two reasons, left hand, right hand. Mm-hmm. And when people don't follow the rules, so to speak, then they become patients. They end up in the office, whether it's elective things such as carpal tunnel syndrome or trigger fingers, which is very common. But I can't emphasize enough the importance that when you hurt your hand, early evaluation is really the key to long-term success. I see too many patients, for example, and we're all guilty of this, right? It's a long holiday weekend. We got too much trash in the trash can. And so what do? We take the bag and we're just going to shove that bag down in the trash can, not knowing that somebody put the broken wine glass in there. Mm-hmm. And as they push on it, then they cut their hand. And they think, oh, well, I can move some of my fingers. Everything will be okay. Or my finger's too swollen. That's why I can't move it. But the problem with that is that, for example, if you cut a tendon in your hand, oftentimes you only have about 7 days to try to fix them. So if the patients come in and they're 2 to 3 weeks out and they've done the typical, we're going to put some duct tape on it, and we're just going to keep going, rub a little dirt on it, and then they come in and see us 2 or 3 weeks later, it's a bigger problem than something that's a relatively easier thing to address. So, hand is something that's a little bit time sensitive. A lot of the finger fractures, for example, in the hands are already healed by week 4. So if you hurt your hand and you think you broke something, but it's 6 weeks later and you come in to see us and it was a bad fracture, let's say, and that healed in a bad position, we're kind of stuck at that point. Mm-hmm. I realize that, some people don't want to run to the doctor for every little thing, and I respect that 100%. I say, but sometimes you need a few things evaluated. And again, if you don't want to have the time to schedule an appointment or just come into the express clinics. I mean, all of our PAs and nurse practitioners work all with the physicians. We're with them every day. So when a patient comes in and let's say they cut their finger and they happen to walk into the express clinic, even though it's not myself or Dr. Seth or Dr. Klima or Dr. Eschbach who's there to be right there with them, the PAs all get us so we can take care of the hand injuries. And so really, again, it goes back to that same thing I alluded to earlier, which is the feasibility of getting in to see people. Hand's a complicated thing. I love hand. Some like chocolate, some like vanilla. I like hand. Early in my career, I used to do all of trauma, and I'd fix hips, and I would still introduce myself as a hand surgeon to the patients. But I would say, "Don't worry your hip; it's just a big finger. It's all fix it the same way. Not a problem." But now, as I'm getting into the twilight of my career, I'm actually entering a new phase, which is really, really hard, and that is trying to recruit to find our replacements. Right? So in our groups, we're kind of a 65 and out policy in our group for the orthopedic surgeons, and I have 5.5 years to go.
Personally. I know. I keep waiting. You tell me the time all the time, so I keep waiting for the days.
Yeah, the joke in my office is I know it down to the day.
Yes,
but
you
it's
do.
Always the joke, and I absolutely love what I do.
I have to report it to my mother, as a matter of fact.
Yes, it's 2022 is left today. But I tell you, it's a very surreal experience. I remember when I was recruited back in '96 out of my fellowship. I was at Brown at the time in Rhode Island. And now as I'm going through the interviewing process and trying to find those individuals down the road to continue along, I think it's really, really important to continue along with this process. At OrthoUnited, we really believe in this generational medicine, and where, as us older gray-haired guys start to, fall off the treadmill, so to speak, we really want to continue to take care of this community. Yes, I say.
We
look
do
around.
the same thing in
Absolutely.
radio.
Yes, you want to pass the baton, and I think that's very important. I think sometimes people overlook the fact that one of our most important jobs is to continue along. OrthoUnited will hopefully be here for many, many years beyond Ira Richterman. I've been here for 27 years. I'm going to be here for another 5.5.
2022 days.
Yeah, 2022 days. And but yeah, I think that's important, because it's not just about me, myself, and I. It's about we and us. I think most of the physicians we are very strong. We have a new physician joining on the campus side. Dr. Barnett joins us July 1st for foot and ankle. On the Spectrum campus side, we will hopefully have 2 more physicians joining them for next July. A sports doc and a total joint doc. And it's just because physicians are retiring, right? So Dr. Pence retired, Dr. Likens retired, Dr. Conlon's retiring at the end of this month. I mean, these are people that have been very, very, very strong icons and have been great healthcare providers in this community for a long time. And so you've got to think beyond just treating today's carpal tunnel or today's broken finger. You really have to think tomorrow. And I think that's very important, but it is surreal. It's hard to, as I go through and try to recruit these young doctors to come to the area, I think we've built a wonderful practice and opportunity for them to come into. And I hope one day they can do the same thing. I hope 25 years down the road they're thinking of the same thing when they sat through interviews and they think, I hope I can give back to the younger docs in my group one day the same way as my older partners did for me, without a doubt.
Yeah.
Without a doubt.
And that's wonderful that you're actually even doing it and talking about it, because not every place does that. For sure.
Yeah, it becomes a sudden stop is the problem.
Yeah.
When physicians and groups really don't plan for their successors, that's where the big business of healthcare comes in and gobbles up the little hardware store.
Yeah,
right. And we just want to continue moving along. I mean, we work well with the hospitals. We cover trauma call at the hospitals. We always say if you get hurt and you end up at various places, I say ask for OrthoUnited. We'll be there to take care of you. Doesn't matter the time or the place or the location.
This is like the Oscars, when they start playing the music and you have to stop talking.
That's exactly correct. I know my cue.
That's it. There you go. It's always so wonderful to talk with you. I'm so glad we had a chance to do this.
I appreciate you having me on. I really enjoy this opportunity.
I'm still glad there's 2,000 days left.
Yes, we'll
at
get
least. All right. Thank you so much, Dr. Richterman. All right, we will take a break for the news, and when we come back, we're going to discuss back and neck pain, and we're also going to discuss the pitfalls of narcotics in pain management and some other things as well. We'll do that here coming up. It is Health Week on 1480 WHBC.
Ferndale Water Experts have been a locally owned and family-operated business for over 65 years. For all of your water treatment needs, call the name you can trust. Call Ferndale Water Experts.
Tap into Ferndale's Water Center.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the WHBC newsroom, the NFL season, the AFC North will be getting the spotlight on the in-season edition of HBO's Hard Knocks. It'll be the first time the show will chronicle an entire division. All 4 AFC North teams will see the spotlight: Cleveland, Pittsburgh, Cincinnati, and Baltimore. Hard Knocks in-season will start on December 3rd. Sheriff Mike Bouchard of Oakland County, Michigan, says 2 people are still in critical condition after that shooting at a splash pad. 8-year-old boy in critical condition, making amazing progress. A new survey from Bankrate shows 18% of Americans say student loan debt is a major influence on how they will vote in November. Among the survey, 29% of the respondents say they have student loan debt and it will be part of their voting strategy. Cleveland Guardians, they were off last night. They're at home tonight against Seattle. You'll hear the game on WHBC.
Your severe weather station, News Talk 1480 WHBC.
Here's the AccuWeather forecast. This afternoon, partly sunny with a few widely separated thunderstorms, the high 93. Tonight, cloudy and humid, low 72. Partly sunny, hot, and humid for tomorrow. A thunderstorm in spots in the afternoon hours. High Wednesday, 91. Thursday, hot with a high 95. And on Friday, a thunderstorm in the afternoon. Partly sunny, hot, and humid. High 93. I'm Andy Raub for News Talk 1480 WHBC.
Pizza's here. Oh, great. I'd love some, but I'm worried about my stomach issues.
If you're worried about having diarrhea, gas, bloating, stomach pain, or loose, oily stools, it may not just be stomach issues. It could be a condition called exocrine pancreatic insufficiency, or EPI. With EPI, the pancreas doesn't release enough enzymes to break down food, but EPI is manageable. Use the symptom checker on identifyepi.com and talk to your doctor. That's identifyepi.com. Sponsored by AbbVie.
When it comes to my lifestyle and diet, I don't always make the smartest choices.
Touchdown! Woo! Hey, how about another round and some more chips?
But when it comes to taking care of my liver, I do make one very smart choice. Active liver tablets from New Nordic. I used to have real issues with my liver, and at my last checkup, my doc was concerned about my numbers. But since adding a once-a-day active liver tablet, my gut's better, I feel great, and my doctor's happy. I ask a lot of my liver, so the least I can do to say thanks is a daily dose of Active Liver.
You ask a lot of your liver, so give it the support it needs with Active Liver. You can find Active Liver at Amazon.com or ask for Active Liver at your local CVS. Or for a volume discount, visit NewNordicUSA.com. Go to new, NORDICUSA.com, Amazon, or ask for Active Liver at your local CVS.
The Plain Township Amphitheater presents the Motown Sounds of Touch, Thursday, June 20th at 7 p.m., featuring a full band and all the major hits from the Motown era. Tickets on sale now at plaintownshipAmphitheater.com.
Crown keeps you warm and we keep you cool.
We're here for you day or night. As the summer heat kicks into high gear, nothing is more essential than a reliable air conditioning system to keep your home cool and comfortable. At Crown Heating and Cooling, they understand that a reliable air conditioner is not just a luxury, it's a necessity. Stay cool, save money, and enjoy peace of mind day in, day out. When it comes to your comfort, Crown is here to ensure you have the very best. If you have an older and efficient air conditioner or you don't have one at all, now is the perfect time to call Crown and find out just how affordable a new Carrier system can be. You can trust Carrier, the company that invented air conditioning. Enjoy increased comfort and energy savings all year round. Or if your current air conditioner needs a tune-up to ensure peak performance, Crown Heating and Cooling will help with that too. With Crown, estimates are always free. Call today and let Crown show you how much you can save when you turn to the Carrier experts at Crown. Call 330-499-4988 or on the web at crowngroupohio.com. Ohio license number 27133.
Call Crown Heating and Cooling. You'll be sure you have the best. Crown.
Welcome back to Healthcare Week on 1480 WHBC. And again, a big thank you to Dr. Richterman. We always have a great conversation with him, and he doesn't talk enough about the things that he does as a hand and wrist surgeon, but a wonderful job that he does. And all the doctors in the group here have done a wonderful job, and we always enjoy talking to them. And this is a person that I have never had the pleasure of speaking with, but we're going to get some great information from Dr. Chauhan. And let's see, where should we start? How about we start with causes of back and neck pain, because I don't think there's a person in this room, even the young one over there, who has not suffered from back and neck pain. Would you venture to say that's probably true?
Yeah, I would say so. I mean, it's we've all had issues. You wake up with a kink in your neck. I'm Dr. Chauhan, by the way. Thanks for having me. And thanks for doing this for the community. But yeah, it's most commonly the causes. The patients that have or people that have back or neck problems most of the time don't need to come in and see somebody. The things usually get better with a little rest, and it turns out to be a little muscle sprain. But going beyond that, absolutely, arthritis is by far the biggest cause that we see in our practice for people who have issues with their back and neck. But there's a lot of components on top of that you've heard of stenosis, and you've heard of some of these terms like sciatica, or what causes all those things. Yeah. The primary source is arthritis, is wear and tear. We collect mileage just like we do in our shoulders and knees and hips. We collect mileage in our spine, and so arthritis over time develops. You develop spurs and calcifications. I think we all have a general understanding of what those are, but they take up space, and that means there's less space for some of the important structures like the nerves. And so when you have areas that in the spine, whether it's the neck or the low back, that have a little restriction in the amount of space for the nerves, we call that stenosis. Mm-hmm. So, when we see that phenomenon happening in arteries, we usually call it blockage. So really, you could interchange those two words. It's really the same type of thing going on. It just means narrowing. So, when you don't have adequate space for the nerves, they get constricted, and that's when you develop the symptoms of the legs feeling numb and tingly. It's a very common phenomenon where standing and walking becomes difficult as we get older, and then you hesitate to go do things, so going with the family out to the beach or the zoo or whatever, because you don't want to use a walker. I mean, that might just be kind of one of those things where no one wants to take that step and use a walker. So you start missing out on activities. There are treatments, though. It's in a lot of, I would say many people are fearful of, they're going to go in and do surgery. I don't want back surgery. But that's my role. I try to keep patients from having to take that next step. At certain times it's the right thing to do, but the large majority of the time it's not necessary. And sometimes even some simple exercises at home can help. I think educating and understanding exactly, and everyone's spine is different. So understanding what is going on specifically with your spine, I think, is important, just to understand why the treatments that we recommend, why we recommend them, why the specific exercises that are being prescribed by the physical therapist, why those are important to do. And if you buy into it, you're more likely to do those things at home. And then, treatment-wise, if symptoms are not letting up with Tylenol and rest and physical therapy, then injection therapies can be very, very effective. Epidural injections. Steroids reduce inflammation. So you're not making that space bigger where the nerves sit, the spinal canal. You're making the tissue fit in there more comfortably. And so you're reducing the swelling on the nerves, you're reducing any inflammation in the epidural space, and that relieves pressure on the nerves, and that usually results in pain relief. Now, injections aren't permanent. If you get good relief for a few months, then you can safely get up to about 3 injections per year. The less the better, of course. Anything we do, most things we do carry some risks. Diabetics need to be careful with steroids. They need to monitor their blood sugars because steroids will cause a little spike in blood sugars, but usually that's a temporary thing. Now, beyond that, let's say a lot of people that just have the back pain and don't have the leg symptoms. Again, how do you treat arthritis? Again, if the therapy and Tylenol and anti-inflammatories aren't doing enough, we have treatments for that as well. They don't work for everybody, but they do work for a good percentage of people, and it's not surgery. So there's no big downside in trying some of these treatments. The one I'm referencing specifically is called ablation, radiofrequency ablation.
Is that something new?
No, that's not that new. It's been around for a while. A lot of people have heard of ablation because cardiac ablation is common, right? So, and what you're doing in ablation is you're essentially turning off a nerve. You're stopping that nerve from functioning. Well, the nerves that we address in the lumbar spine and the lower back or in the neck are the nerves that are feeding the joints that are contributing to you sensing the pain coming from those joints. So you could get a little wire right next to that nerve, and it heats up, and then it turns off the nerve. So not everyone's a candidate, and not everyone's going to get relief. But depending on how much you're suffering with the pain and what your options are, it's something that is something that we offer for the right patient. The patient selection is very important. And then finally, I was going to touch on spinal cord stimulation. Okay, now this is for patients who've had back surgery, who have pain has become a part of their life and it's taken over their life. If you've already had back surgery, or sometimes even 2 back surgeries, well, where do you go then? There is a treatment that has been around again for a while, but the technology has gotten so good. We're getting nearly 80% relief of these patient symptoms, and these are people whose lives have been changed because of this pain. And so how it works is there's a little electrode that we place in the spine that scrambles the pain messages before they get to the brain. So pain let's say that's coming from sciatic nerve or from the low back, or let's say you have screws and rods in your back and those are causing pain. An electrode can be placed in a position in the spine such that it scrambles those pain messages before the brain has an opportunity to perceive them. It almost sounds too good to be true.
Yeah.
And the treatments today from that procedure are much better than they were 10 years ago. So that's an area where the technology has been around for a while, but it's gotten much, much better.
Is back problems, or are back problems, genetic?
Yes, absolutely. There's a genetic factor. We were talking about the stenosis and the canal size. A lot of people are born with a smaller canal, and that's just the luck of the draw. Some people have a wide open canal. Some people have arthritis that you could say is more accelerated or aggressive, and that's a familial predisposition as well.
Okay. And what about, you were kind of going through the process. What about the decision to have surgery? Where does that come in?
Well, the surgery sometimes is the right thing to do. Now, if we get an opportunity to treat a patient who's done all the appropriate treatments, and let's say we've done an injection or 2, and they're only getting a week or 2 of relief, or let's say even 2 months of relief, we don't want to do those injections any more frequently than about every 4 months. So depending on their health, depending on other factors, who's at home to help them. I mean, most of the time, the smaller procedure that doesn't involve aggressive screws and rods and stabilization is an outpatient procedure. So it's not the end of the world if you do need back surgery. And again, patient selection is important. And it's important, I think, to have, in my philosophy, is to have the patient understand their issue and be actively involved in making some of these decisions, because sometimes there's no right answer. A lot of these things depend on how bad is your pain, how bad are you functioning, are you getting depressed, how are your relationships at home, are you just laying around more and your body's getting weaker. So, you know, some of it is education, because a lot of people are afraid of having surgery. But, you know, if you spend a little time and explain things, sometimes it becomes a little easier to digest that. So.
All right, well, we're going to take our final break, and when we come back, we'll talk more about the possibility of eliminating narcotics as a way to manage chronic pain. That would be great for a lot of people, and we will do that as we continue with our Healthcare Week, and that is right here on 1480 WHBC.
I didn't ask to be thrown in the streets with nowhere to go, but I did ask for help, and Covenant House was there for me.
1 in 10 young adults will experience a form of homelessness this year. For these kids who didn't ask to be put in this unthinkable situation, Covenant House is there, providing hot meals, a safe place to sleep, medical care, and love.
They just really genuinely just wanted to help me succeed, and I'm succeeding.
To learn more, go to safeplacetosleep.org today.
Tune in each Saturday morning at 8 a.m. for the Money Matters radio show. Hosts Bob Foudy and David Ryan help you make your money matter. Find out how today's economy, debt levels, and policies affect your hard-earned money. You've made your money. Now it's time to watch it grow. Tune in to the hour-long Money Matters radio show every Saturday morning at 8 a.m. right here on News Talk 1480 WHBC. To speak to Bob Foudy or Dave Ryan about your money matters, call New Horizon Financial Group in Canton at 330-499-1915. 330-499-1915. Living at the Waterford can be life-affirming, as this reenactment of actual residents can attest.
I'm living at the Waterford. Have been for 3 years now. Wish I could have said it was for 10.
My wife and I chose the Waterford and are glad we did.
I'm not sitting around doing nothing. My life is full, far more than it ever was.
At the Waterford, there's an undercurrent of family connection. We all feel like we belong and can depend on each other.
My children are delighted. They say they're happy to see that their mother is smiling and happy once again. I'm not sitting at home just thinking about the past and wondering where did my life go. I've got a new one.
There's a sharing spirit. You sleep better at night knowing you're in that kind of atmosphere. Management is very helpful and concerned, and there's very individualized help.
When you're ready to retire, consider moving to the Waterford.
The Waterford, North Canton's premier independent senior living community. Contact Yvonne Herron at 330-966-5643 for availability.
When you use Bounce dryer sheets and your clothes look amazing, it's the sheet. Less static in your life? Yeah, it's the sheet. Smelling fresher than ever? It's the sheet. Oh, so soft fabric? Ooh la la. It's the sheet. Less wrinkles on your clothes? You know it's the sheet. Bounce dryer sheets. More freshness, more softness. Less static, less wrinkles. It's the sheet.
I didn't ask to be thrown in the streets with nowhere to go, but I did ask for help, and Covenant House was there for me.
1 in 10 young adults will experience a form of homelessness this year. For these kids who didn't ask to be put in this unthinkable situation, Covenant House is there, providing hot meals, a safe place to sleep, medical care, and love.
They just really genuinely just wanted to help me succeed, and I'm succeeding.
To learn more, go to safeplacetosleep.org today.
If you need bold banners to boost your business, but you're on a budget, think Staples. Because now at Staples, you can save up to $50 on your print purchase. From posters and flyers to signs and menus, Staples can print anything you need to move your business forward. And with Staples Print Perfect Guarantee, it's done right or it's printed again free. Plus, same-day service is available on hundreds of items if you order by noon. Get it printed right at Staples. And now get up to $50 off your print purchase. N76, visit staples.com/print for details.
We're recording this Progressive commercial on a real boat to let people know that when you bundle your home, boat, and other vehicles...
What was that, Flo?
Progressive saves you money, Jamie.
Why are we doing this on a boat?
We were going for authenticity.
We're going to the city?
Authenticity.
You mean Atlantic City? But we're not in the Atlantic. Are we?
Bundle your home and other vehicles with Progressive. Progressive Casualty Insurance Company, affiliates, and other insurers. Not available in all states or situations.
This is the story of the one. As a maintenance engineer, he hears things differently. To the untrained ear, everything on his shop floor might sound fine, but he can hear gears grinding or a belt slipping. So he steps in to fix the problem at hand before it gets out of hand. And he knows Granger's got the right product he needs to get the job done, which is music to his ears. Call, click Granger.com, or just stop by. Granger, for the ones who get it done.
Pizza's here.
Oh, great. I'd love some, but I'm worried about my stomach issues.
If you're worried about having diarrhea, gas, bloating, stomach pain, or loose oily stools, it may not just be stomach issues. It could be a condition called exocrine pancreatic insufficiency, or EPI. With EPI, the pancreas doesn't release enough enzymes to break down food, but EPI is manageable. Use the symptom checker on identifyepi.com and talk to your doctor. That's identifyepi.com. Sponsored by AbbVie.
And it is Healthcare Week, of course, as we've been mentioning, and have had such a wonderful couple of hours with OrthoUnited. And we are at the Oasis Surgery Center, and appreciate everybody who has stopped by. A big thank you to everyone who has stopped by. But we still have some things to talk about with Dr. Chauhan, and we want to talk about now, because I know a lot of people think about this. And, you know, chronic pain is also something very hard for people to take care of. It can be debilitating for a lot of folks, and I heard you mentioning, like with Dr. Richterman when he was in here, it's very easy to hand somebody a prescription, but that is not the best way to handle things. So talk a little bit about how people are handling chronic pain nowadays.
Yeah, so I mean the pendulum has really swung from 10 years ago. It's one of those things where there's not necessarily a right answer until we can figure out how to safely deliver some of these opiate-type, narcotic-type medications that don't have all the additional baggage that unfortunately they do have. But you're right, it's chronic pain, you don't really appreciate it until you have a loved one or you yourself are going through it, because it changes a person. It changes the personality. You can have a bright, chipper, happy person become a miserable, depressed grump. So treating the pain is critical. Sometimes you even need to get a psychologist involved, and so that gets to what are options to manage chronic pain. I mean, we talked about a few of those treatment options, and where do narcotics fit in? Again, this is getting into some philosophical things. Everyone feels like differently. You ask 10 people, they might have a different response based on their own experience. But the big issue, in my opinion, with narcotics is not so much the addiction, but it's the tolerance. Okay, so tolerance is when a medication used to work great, and now you have to take twice as much. And then pretty soon they double your dose, and you're taking 3 times as much. That's the big issue with narcotics. They work great for the first couple, 3 months. But what do you do after that? Then they're not easy. Once you're taking something on a regular basis, it is not easy to stop it, or to discontinue it or wean off of it. It can be done, but it's just not a pleasant experience. So what are you really achieving long term? Now, there are some patients that are treated with narcotics. I mean, we don't do that here. We usually send those patients to a pain clinic. And so I'm not saying narcotics don't have a role. But I'm glad to see, generally speaking, that we've figured out a safer way to deliver those in a more confined way. It used to be, like we were talking earlier, that someone is in pain. The easiest thing to do is write a prescription. They're happy. They came, and a lot of people, that's all they want is just a prescription. But to take the time and explain all these things is the harder path, but is the better off for the patient in the long term. And that's been my experience practicing for 25 years. I've had too many patients. I put them on narcotics, and 6 months later, they're just like, Doc, I'm in a lot of pain. And they're no better. If anything, they're worse, because now they have a dependence on a medication. And if they don't take it on time, they get withdrawal. And so you're kind of, quote-unquote, hooked on this medication. Now, the pharmaceutical companies are trying to find medications or ways to deliver these medications so you don't develop that tolerance. I mean, it'd be great if I could start you on a medication and it worked and you took it twice a day, and what's the harm there? It's not a big deal, even if you are dependent on it. if you are quote-unquote addicted, and most people aren't addicted, they're dependent. There's a difference. Dependent, just like I'm dependent on coffee. If I don't have my coffee, I get a headache, and that's just a physiologic response. So we don't judge that, you know.
Right.
But the addiction carries so much negative baggage with that term. But if we could find a way to have these medications work without developing a tolerance, then I think we'd have a whole new paradigm, and that would be great if we can use medications adjunctively with our other treatments. Another controversial topic now is medical marijuana.
Right.
Where does that fit in? I'm a proponent. I mean, what's the harm? You know, I think a lot of people, especially our elderly community, that grew up in the 50s and 60s and 70s, they have a preconceived notion of what those are. They're drugs.
Yeah.
And, you know, we did a good job over the decades of labeling that as bad drugs, and, you know, the whole anti-drug movement, and which is great. I mean, that's necessary as well. There's got to be a balance. But those things can also be effective. You know, and we're getting off a topic of narcotics, but, you know, we always try to explore those alternatives before sending or referring someone to a pain clinic for narcotic management.
Well, actually, we've reached the end of our time this morning, so we
great. Thank you
covered
for
a lot
having
of.
me.
Yes, I'm so
Appreciate it.
glad you stopped by. It was wonderful meeting you, and I
Thank you.
appreciate
Same here.
everything that you have shared with us. And thank the folks here at OrthoUnited. We appreciate it. Tomorrow, we will be talking to the folks at Altman Hospital, and also a visit to Jackson Family Practice. So we hope you'll join us.